name is Natalie and I am one of Dr. Monae's dental assistants. Today I'm going to go over the proper way to brush and floss our teeth. The main cause of periodontal disease and tooth decay is bacterial plaque, and plaque is a colorless sticky film that is constantly forming on our teeth, so we have to make sure that we remove that plaque effectively. You want to begin by starting off with having the right equipment. You want to use a toothbrush that has soft or even extra soft bristles, and you're going to hold your toothbrush like you're holding a pen or a pencil. This is going to help apply less pressure. You do not need to pre-rinse your toothbrush, and you only need a pea-sized amount of toothpaste. Let's say that you're going to start brushing your lower teeth. Always start off on the same area, that way you avoid missing any spots. You're going to put your toothbrush parallel to your gums, and you're going to move your toothbrush in an upward motion. You're going to do this 15 times, tooth by tooth, one tooth at a time. Again, you're going to do this 15 times, tooth by tooth, one tooth at a time. Right now I'm doing the outside surfaces, but you want to make sure that you do the same thing on the inside. So remember, you'll do 15 strokes, tooth by tooth, one tooth at a time. For your anterior teeth, if your toothbrush does not fit horizontally, then you can do it vertically. For the chewing surfaces, you can just go back and forth. And we're going to do the same thing on the upper teeth. But now, instead of bringing the toothbrush upward, like we were doing the lowers, we are going to bring the toothbrush down for the uppers. But just remember to do the outside surfaces, to do the same thing on the inside, and go back and forth on your chewing surfaces. Now I'm going to demonstrate how to floss correctly. Remember that flossing is just as important as brushing our teeth. You can use waxed or unwaxed, whichever you prefer. And you're going to wrap the floss around your middle fingers. You want to remember to floss the very back tooth, although there's not a tooth beside it. Whenever you're flossing in between your teeth, you want to make sure that you do not snap the floss. Whenever you snap the floss, you create floss cuts, and floss cuts leads to gum recession. So in order to break through the contact point, instead of snapping it, you want to move your floss side to side. So move your floss side to side. Once you break through the contact point, you're going to wrap the tooth with the floss. So you're basically going to be hugging the tooth, and you're going to move that floss up and down. And you'll do the same thing for the one that is beside it. So you'll now hug this tooth, and you'll move the floss up and down. If you do not like to wrap the floss around your middle fingers, what you can do is get a long piece of floss and make a knot like this. So now it's going to allow for you to just have to hold it like this. And now you're not going to have it wrapped around your finger. So I hope you learned something new with this demonstration. And remember, you only want to brush and floss the teeth that you want to keep.